welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 84, we're joined by psychologist Renee Exelbert. And Renee is a very unique psychologist in the sense that she combines her traditional psychotherapy modalities with exercise and movement. And I think there's no better conversation that we could be having right now than this, because we're all very aware of the mental health crisis that's gripping our nation right now. And as Renee and I will talk about in this episode, she's incorporating aspects of psychotherapy, visualization, meditation into traditional exercise movements. She gave such a great example in the episode of, sitting on a leg press and pushing the weight away from you. But, what are you really pushing away from you in your life? What are you really fighting for in your life when you're doing that leg press? And it's just such a way to make exercise more deeply meaningful and impactful. We'll get into a lot of, I think, really, really important things in this discussion. Particularly, we'll even talk about how to, destigmatize mental health as a fitness professional and have productive and healthy conversations around it with our clients. So many pearls of wisdom dropped in this episode from Renee. Any information we'd like to share with you from this conversation can be found on the show notes page. That's by going to wellnessparadoxpod.com/episode 84. Please enjoy this conversation with Renee Exelbert. Today, we're delighted to be joined by Renee Exelbert. Renee, thank you so much for joining us.
Absolutely.
Well, I'm excited for this conversation because, as I said when we were talking off air before we got started, anytime we can blend psychology and exercise and fitness, I always think that's kind of the ideal scenario for improving human health and human flourishing. So that's what we're going to kind of dive into in this conversation. But before we get into that, why don't you give us a little bit of an idea of your background?
Sure. So I was a psychologist for probably, I'm losing track, maybe about 15 years. And I was working in a pediatric cancer center with kids diagnosed with cancer. And I loved it. It was beautiful, holy work. But after many years, it was time to sort of back away from the excessive trauma. Yeah. And shortly after I left, I was diagnosed with breast cancer. And so I researched everything possible about how to get rid of cancer, how to stay healthy, how to stay alive. And of course, one of the things that is salient in the research is the importance of exercise. Yeah. And I had already been active. I've always been somebody who worked out, but I became really involved with exercise to the point where I, hooked up with a personal trainer and was working out all the time, and eventually put on the bikini and the stripper heels and flexed my muscles to mark my 5th year of after having been diagnosed. It was sort of to mark the me being back in sync with my body, which felt really great. And during that whole process, I found myself talking to my psychology patients about the importance of exercise, depression, anxiety, and I was showing them how to do squats and all these things. And then I realized I probably should, do this legally. And I became a certified personal trainer. And then I started getting really involved with nutrition and integrating the two. And I founded this center called the Metamorphosis Center for Psychological and Physical Change, where I integrate psychotherapy and exercise.
That's great. What a great story. And we should clarify for our listeners that may not understand what you said. You did a bikini show or a figure show.
A figure show, correct.
Just so we put some guardrails around what you said there, so no one goes off anywhere that wouldn't be appropriate. I love that. I love the courage that takes to go through that kind of journey. And I'm in a past life, I got up on stage for a bodybuilding show, and it is a really, it's kind of a validation that you've taken control of that part of your life. And that's an amazing, journey that you've been on. Talk to us a little bit more specifically about what you do, at the Metamorphosis Center. And we're going to dive into this deeper and deeper in the podcast, but I think a lot of our listeners will be very curious, at least on an operational level in your business, how you go about blending the two.
Sure. So I see children, adolescents, and adults for traditional psychotherapy, but I often find that we can use both visual imagery and our thoughts combined with exercise to augment or overcome certain obstacles that are presented in therapy or presented with the individual. For instance, if I'm working with an adolescent who's being bullied, obviously exercise is something that's really empowering. Exercise is something that makes somebody feel in charge of their environment or an active agent on their environment. So I may, after having known the individual for a while and hearing their struggles, be able to move on over from my psychotherapy couch to where I have a gym area, and we'll pick up some weights, and we'll start with visual imageries of literally the client lifting the weight and thinking about, as he's lifting the weight, he's incorporating strength. And as he's pushing away bullies. And we'll do some sort of mental mantra around that. And it's after I've known somebody for quite some time that it can be very, very powerful. I'm working with a woman right now who she's in her 60s, and she had 4 women who she grew up with and spent her life with. And all 4 of them were diagnosed with cancer, all 4 of them. And 3 of them died. And she's the only remaining survivor. And she talks a lot about how she's next, right? And for me, that's like, you can never think that way. And so I came up with an imagery with her about, like, literally, it's like almost doing a chest fly, right? To sort of convey her connection to these women who stood beside her whole life. So it's like the chest fly opens up to embracing these women, and then it comes back to her core, and then it's a shoulder press, like she's actually knocking herself in this box where disease can't taint her, right? She's in this box, and she does a shoulder press to the sky and opens it up, like almost like the light, God, the universe, whatever you believe, is shining, and she's open for it. And then she comes back to her box, closes up, and it's like a very protective, but it's an exercise. And so when somebody does exercises, right, we always think of the mind-muscle connection. In addition to the mind-muscle connection, it's these thoughts that can be extremely powerful for somebody, because it's an imagery connected with their history, connected with verbal mantras and exercise. So it's very, very empowering. And the more someone does it, the more they can sort of incorporate this visual imagery into their world, right? And it's like every time they do the exercise, they can think about this. And we know from the creation of neural pathways, right, that every time we do these things, we're making the connection stronger and stronger. And so all of these things together combined just are so powerful.
Yeah. Wow. Talk about making exercise more deeply meaningful than just, moving weights around. So I mean, I have so many questions coming off of all those amazing things you said, and I don't want to take us too much down a rabbit hole, but there are 2 questions that come to mind most immediately. And I asked the first one that's coming to mind is, I can't imagine there's a lot of information out there in the literature on this kind of, practice of blending, traditional psychotherapy and exercise. How did you come up with this methodology?
So I named it visual emotional kinetics. I had to put a name, I had to put a name on it, right?
Yeah.
And so how did I come up with it? I think that it was really born out of the experience of powerlessness through cancer, and trying so hard to come up with whatever I could to empower myself. And exercise for me was so important. My journey becoming a personal trainer was so important. Nutrition was so important. Visual imagery, right? Seeing myself get well, seeing myself healthy and strong, all so important. Verbal mantras, so important.
Yeah.
Therapy, so important. So combining all of these things together, it was just sort of my baby. And I had, created this center where I literally have like my diplomas and my stodgy psychotherapy couch, right? And a gym. And I literally, move fluidly from one to the next, depending on what's going on with the person.
Yeah. I mean, your lived experience was the best teacher here, it sounds like. So now I'm going to go to the complete other end of the spectrum, and this is the healthcare economist in me that is curious, because I know I have some friends who are psychotherapists who work in the mental health world that always talk about wanting to incorporate exercise and fitness, but there's the pragmatic reality of, well, like, how do you bill for this, or how do you get reimbursed? So I'm just curious how, when you're incorporating the exercise element into this, how you work that into your actual economic model when and if you bill.
So I legally bill for a psychotherapy session.
Got it.
And I have obviously all my clients sign a waiver for, for personal training. And that, that's it. I looked into that, what's the legal ramifications here, right? So, so because I'm a licensed psychologist, I bill for a licensed psychology session.
That's great. Yeah. So it was probably one of the first things that came to your mind too, when you're thinking about doing this. Like, this is great, but I need to make sure it's above board. So, okay. Well, I want to bring us back to, need to get us away from the billing questions, because that takes the conversation down a whole different direction. So, I think you did a really good job of telling us, why and how you integrate exercise into psychotherapy. What can the fitness professionals that listen to this podcast learn from what you're doing? And, even maybe take it a step further, how can they incorporate some of the things that you're doing within their scope of practice, of course?
Absolutely. I think that the world is changing so rapidly. And I think the onus on all fitness professionals, and not just fitness professionals, all health professionals, is to really see the mind-body connection. Right. So everything that we feel shows up in our bodies, right? And everything that we experience in our bodies eventually shows up in our mind. So if we're having a really, really stressful day, we're probably going to get a headache or a stomach ache or manifest some physiological symptom. And if we're really physically sick, we're probably going to walk around kind of sad or a little depressed, right? So that's the mind-body connection. And so the onus on all health professionals is to understand that everything that we take in, our nutrition, our thoughts, our exercise, everything is all integrated. And so you can't be a fitness professional and not understand the importance of nutrition and non-processed foods, and how inflammation impacts mental health, not just physical health. Inflammation clearly impacts mental health. Right. We now know this. And so we also know that exercise helps every single physical disease, right? Every single physical disease. I just saw an article that came out yesterday that talked about how exercise is now proven to even exacerbate the efficacy of the COVID booster. Right? Like, exercise is everything. Right. And so how can fitness professionals integrate what I'm doing? I think, number one, to understand that it's all connected, that we do have to stay in our own lane, so to speak, but that wellness, fitness professionals are wellness. We're wellness professionals. We're about health and well-being. And you can't just look at exercise. Even if you're an amazing personal trainer, you do need to know a lot about nutrition. And you also should know that when your client comes in, they may be dealing with injuries, which is going to impact their headspace, right? They may be dealing with medical conditions, which will also impact, and it's all connected. And so I think understanding that is critical. That's a critical thing.
Yeah. So, I'm curious, I feel like, and fitness professionals deal with this a lot, and I'm sure you run across this in your practice, and I think you're eminently qualified to speak to this. Some people just have an aversion to exercise. Even the word, as for some people, can be triggering and challenging. So kind of a two-part question here. One, how do you approach that in your practice with people's kind of preconceived notions of what exercise is? And then secondly, and kind of going off of that, how do you think fitness professionals can help to ease people into the process of exercise that may have some of those aversions or kind of triggers towards doing it?
Obviously studies talk about the importance of finding something you love.
Yes.
And I also think that people see exercise as all or nothing.
Uh-huh.
So much so that we see on January 1st, like a 75% increase in
Yeah.
the gym, right? And by like January 30th, everyone's gone, right?
Yeah.
People see exercise as all or nothing. And even when I speak to my patients, they say like, oh, I haven't been to the gym, or I can't get back to the gym. Exercise doesn't have, our muscles don't know if we're in the gym or sitting in front of Oprah, right? Like they have no idea,
Yeah.
right? And so we can do small exercises or movement throughout the day that adds up to a lot, right? So I talk about just small sustainable changes, whether they be in your mental health, your nutrition, or your exercise, small sustainable changes that you just do to kind of wake your body up, right? And once again, it's about like neural pathways. The more we do things, the more we get used to them. And we can also do something called habit stacking, right? If you have a cup of coffee every morning, when you get a cup of coffee and you're going over to the coffee machine, legit, do standing leg lifts, right? I mean, people think I'm completely bizarre, and I've given up on all social, graces. I'll be on the deli line and I'm doing calf raises. Like, this is how I live. My kids, they think I'm from outer space. I will walk from the kitchen to the bedroom doing walking lunges because it's like, just get it in.
Yeah.
And when you shift your mindset to these very small changes, whether they be nutrition, like I said, or exercise, it adds up, right? The idea isn't, even with nutrition, the idea isn't, get rid of all your junk food, right? It's like small changes. Instead of having 3 chocolate chip cookies, have 1.5, right? Small changes. And I literally start with my clients, even when they're sitting on the couch and they talk about the aversion to exercise, I say, stand up. And they stand up and I say, now sit down, right? And I'm like, you just did like a variation of a squat.
Yeah.
And then, and I'll celebrate. I'll be like, woo, woo, right? Like, this is me, right? But like, it's easy. And the more that, and I think that for a lot of people, there's a lot of fear associated with doing things wrong, being judged by others. I see many people, women in particular, who are afraid to go to the gym because they're afraid that they don't know how to operate equipment. They're afraid that they're going to be judged. And I tell them, like, people are way too busy looking at their muscles in the mirror to care about you.
Right.
But they, I often will just teach people some basic things, and it's like, just build on that.
Yeah, I think you're so right. I mean, you said it. Your muscles don't know if you're in the gym or if you're in the park or if you're doing walking lunges from the kitchen to the bedroom. They don't, and I think that that's such an important on-ramp to getting people more involved in this. So there's this movement, I guess pun intended, I think what is a really positive direction in the fitness industry to start to embrace the mental health benefits of exercise more and more. There was, recently, and you probably saw this report published by the J.W. Brick Foundation on mental health, the Move Your Mental Health report, which is this 80-page report looking at all the literature that was out there. And there seems to be this momentum for the fitness community and the mental health community to collaborate a little bit more. From your perspective, as someone who kind of has one foot in both worlds, how would you suggest that fitness professionals collaborate with the mental health community?
That's a great question, and I think it extends beyond the mental health community. I think that fitness professionals should be in every cardiologist's office, in every gastrointestinal. I think that fitness professionals should be, an interdisciplinary liaison in every setting, because we know that wellness, a core piece of wellness is fitness, right? And so with mental health, if it was me and I was starting out, I would be canvassing letters to all mental health professionals, educating them about the importance of exercise with depression and anxiety. And I would show them studies, and I would say, this is another venue that you can try with your patients, and I'm here to partner with you, right? And together we can get great results. That's what I would be doing. That's how I even started out with, I worked in a chronic pain clinic at one point, right? So like, I think fitness professionals should be in every single medical office. And I think that they should be utilized before medicine, like before standard medicine. It should be like, or at least a huge part of education. You're experiencing this, you also need to be doing this, right? And we should be much more of a collaborative, interdisciplinary team for wellness.
Yeah. You said something there that got me thinking in terms of, mental health professionals' awareness of the role that exercise and physical activity plays in, improving, mental health, and maybe, even treating mental illness in some cases. What, from your perspective, as someone who's in the mental health community, how much awareness exists around that? And I guess I'll contrast it with, as a cardiologist, like I think most cardiologists completely understand that people who are more physically active and who exercise are going to have more cardiovascular health. Does that same degree of awareness exist in the mental health community? And if it doesn't, what do we need to do to get it there?
I don't think that it does. And I think that there's a burgeoning amount of literature in the field right now in the world, not just in terms of mental health, but in terms of nutrition and, thoughts and meditation. I think that functional medicine experts are doing a wonderful job raising awareness about that. But I think that there is a tremendous dearth of knowledge about, even for mental health professionals, even about the nutrition aspect, right? And definitely the exercise aspect. So I think there needs to be more education. I'm trying to, get out there myself and speak, because it taps every domain. Where mental health, we have to look at people who are diagnosed with chronic illness, right? We have to look at people who are diagnosed with mental illness. It overlaps in every domain.
I'd like to take a quick break from today's episode to tell you a little something about one of our sponsors. As all of you are well aware, addressing the wellness paradox is a lifelong passion project for me. And when you're going to go on a long journey, it's difficult to go it alone. You need to find like-minded individuals that are willing to go on that crusade with you. And that's exactly what I found at the MRF Institute. The team over at the MRF Institute creates educational content for fitness and wellness professionals who are serious about becoming a part of our healthcare continuum. Getting on the healthcare continuum is all about leveling up our skills to be looked at as that valued resource provider. The wellness paradox is certainly an avenue for you to do that, but we need many different levers to pull if we're going to get there. And the MRF Institute is definitely one of those levers. You can go to their website, mrfinstitute.org, to find all kinds of great, informative, free informational content. And if you choose to engage with any of their paid content, they've created a coupon code specifically for Wellness Paradox listeners. You can enter in WP 2022, that's WP, and then the number 2022 to the website at checkout to receive a 15% discount on your purchase. I highly recommend you go check out mrfinstitute.org. Now back to today's episode. Yeah, absolutely. And I think it is educating, through all the mechanisms, that we possibly can. And I do see some positive movement in the fitness industry to say, hey, you know what, this is a really important and salient area for us to be collaborating on. So,
but equally true, sorry to interrupt, but equally true is educating fitness professionals to of course stay in their lane, but step outside the box of just exercises, right? Like understanding that, exercises are correlated with mental health, and that exercise, I've seen many fitness professionals talking about, diet swaps and, and I'll see like a lot of processed foods that they'll be talking about. And I'm all for moderation but like also, increasing awareness and education and helping them understand that that there's so much more to, than just doing exercises, as I'm talking about, right? Like for me, when I do a push-up, I'm in another space. Like I go down on the floor and I think about all the adversity that I've been through with cancer. Literally, this is where I'm at in my brain, right? And then when I push up, not only am I engaging like my triceps and doing the mind muscle connection, but I'm thinking about, I just pushed myself up and I'm supporting my body. I'm supporting myself and I'm up now. Right. And like, I'm going to continue to push, literally and physically push myself up. And so it's a very meditational, spiritual journey for me. And I feel like fitness professionals, I think everyone who works out gets the meditative nature right there in their zone, and all we gym rats, we get that, right? We get the release, but I think that there's even more to understand about how much it can really impact the brain and our well-being through all these modalities.
Absolutely. Yeah. And that's exactly what I was going to say, is that, yes, we need to educate the mental health community more, but we also need to educate the fitness professionals more, which is, part of the reason we're having this discussion right now. And one of the things that I do want to point out for our audience, because it's came up a couple times during our conversation, is what you're doing in effect is making a traditional exercise, to your point, that would work your chest, your shoulders, and your triceps like a push-up, and you're making it so much more deep and meaningful. Because it's one thing to not want to do push-ups because you're tired on a day and you don't really care about how well developed your arms are, but it's an entirely another thing when you take it to the level that you're talking about, where it's literally you pushing yourself up from the adversity you face. That's got to be something that improves adherence and compliance and motivation for exercise, with just that reframe to a deeper, more meaneful level.
Right. And I think that even if somebody's not a mental health professional, right, if somebody's sitting on a leg press machine, right, and you're the trainer and you're trying to motivate them and they're pushing through, you can literally be like, what problem in your life do you want to crush? Like, what do you want to metaphorically push through? And the symbolism is so important, and it's very powerful. I wish I could study this in a lab. Like the researcher geek in me wants to because I do think that we know about visual imagery. We know about the mind muscle connection, right? So yes, when you incorporate all these things, and back to your original question previously about like, how do we get people to kind of be motivated? I think that's also another angle. Like, it doesn't have to be exercise, right? It's like, what in your life do you want to crush? What in your life do you want to, kick? Right. And it's like, let's literally get up and do a kickbox, right? And we're not kicking anything, but we're kicking your problem, right? And we're punching it as we're kicking it. And even that exercise for literally 1 minute is very powerful. It's like, it's very, very powerful. And there's a lot of therapies that are integrating the somatic piece with trauma, and so all of this is very pertinent.
Yeah, you said it. It seems like this should be studied. I would love in a laboratory setting to get a sense, but in some cases, the real world laboratory that you're operating in is a good testament to this. And I think that what you said there is such a great, valuable lesson for our audience of fitness professionals, which is, how can you take these exercises like a leg press or like a push-up that we think of as just a physical exercise and make it something that's more meaningful and applicable to somebody's life. So, I mean, that's probably one of the biggest pearls to take away from this conversation. I always like to ask this question to mental health professionals in particular. And since I have you on the show, I'm going to ask you this. One challenge that fitness professionals often face is that, and I'm sure you've heard this before, they kind of turn into like the de facto psychologist, for their clients that are just, they're sharing everything with them. And, that presents its own series of challenge. And I'm not going to ask you to tell fitness professionals how they can, handle hearing everyone's problems. But what I do want to ask you about is how you think fitness professionals should approach situations where they're starting to hear things that are clearly concerning and getting outside of their scope of practice, and how they should handle that in terms of conversation and referral? Because I always find that that's such a delicate conversation to have. You're hearing things that may be suggesting that somebody might be, clinically depressed or anxious or dealing with some sort of trauma. And it's always hard to know how to deal with that, but you feel responsible to somehow make a referral to a qualified professional. So how would you recommend that a fitness professional handles that?
Yeah, for 100%. I'm actually writing my second book right now, and it's on mental health stigma. And I think that what you're addressing is the crux of that issue, right? That there seems to be like, we have to gently step around it because we don't want to insult somebody or make them feel less than, right? And so I think it's really important to put forth this paradigm that mental health, physical health, that it's all intertwined. And so one of the ways that I talk about it is like, I break it down really about like mind body functioning, right? And we become less pathologized when we just talk about like wellness, right? Yeah. There are lots of movements now in mental health to have annual mental health checkups, right? Yeah. I send my kid to the pediatrician every year for a physical, yet who knows, right, emotionally what is going on with each child, right? So we need to incorporate that at our legislative level in terms of physical exercise. It's the same thing. We need to be, as professionals, coming forward in a very relaxed way and just sort of talking about the mind-body connection. This is what it is like, and the way that we talk about it, I know as a mental health professional, the way I talk about mental health to my students, the way I talk about it to my patients, I am non-pathologizing. It's like, we're all on this continuum. We all have anxiety. We all get anxious. We all get depressed sometimes. So I think that, learning how to navigate that language, that it's all okay, that we all experience these things. And sometimes, talking to somebody for like, here, you're coming to me for exercise, right? This is what I do. I help people get their frustrations out through the body. Yeah. Other people help people get frustrations out through talking, through the mind, right? You go to a doctor, and so I think that we as a society need to become better skilled at normalizing the interconnectedness between all of these domains, because they are highly connected. And I think that there's been a lot of movement in the world in terms of mental health, with celebrities coming forward and, but I think that each person has a role to play in terms of modeling for others, right? That this is, I talk to somebody or, I have many people who come to me who like are trying to get their anger out. And like another great way is to talk to a therapist. Yeah. So to normalize it instead of making it like,
That's great. Yeah, you said it. That that was not the answer that I was necessarily expecting, but that's probably one of the best answers that I've ever heard to that, is around the,
where's my prize? Where's my prize? What answer are you expecting?
Well, have a good, network to refer to, and have the conversation in private, kind of like the stock answer that you get to that. But to your point, and I've actually not looked at it like this before, but doing it like that, making it a bigger deal goes towards that stigmatization. And I think what you said that I loved about all that, which is probably the thing that's going to stick in my head the most, is that, some people help get their frustrations out doing physical things. Other people help get their frustrations out by talking. It's a different vehicle. So I think that's such a very, I think, pertinent way to be able to look at it. When is your second book coming out? Not to put any pressure with you.
Oh yeah. So, so as soon as I started writing the first page, I declared to the world, I'm writing my second book. Right. So, I think I'm on page like 15 of my proposal. So you submit a proposal to publishing companies, right? So I'm almost done with my proposal, but I'm super excited about it, and I love having new things on the horizon to keep growing. But everything that we're discussing today is part of that. It's, even the question that you just asked, it's all part of how we integrate all of these disciplines, because they are all geared towards the same thing, right? Like we come from a different place, but we all want the same thing, right? And it's like we have to learn to play nice in the sandbox and understand that we each have a really important, an individual role to contribute, yet we all can come together to collaborate to make the best, solution for the individual.
Yeah, well, you're going to have to keep us posted on, when that second book gets out there, because I know our audience will, after hearing this conversation, I'm sure will love to read it. Tell us more where people can go if they want to find out more about you and all the great work you're doing.
Thank you. So listen to this podcast first and foremost. And I'm on LinkedIn and Instagram. My first book is called Chemo Muscles, interestingly enough, right? And it documents my journey of being a psycho-oncologist working in a cancer center and then becoming a patient. And Chemo Muscles, because it talks about my journey with exercise and nutrition and how it became such an important part of my healing. I really, I think that exercise is such a meditational, mindful healing agent. And when I spoke previously about my figure competition, it was holy for me. And it was rebuilding. It was so significant because, I balked at, when people used to say, are you going to do a fitness competition? I'm like, I am not standing on stage in a bikini. Like, that is not me. Right. But when I did it after 5 years, and it marked for me, not only the fact that I overcame cancer, but that I got back in touch with my body, because when you have cancer, you feel like your body betrayed you. Yeah. Really, when you have any health condition, you're like, what's going on? Right. That's not what I thought was happening. And so exercise is just, phenomenal. So yes, I'm on LinkedIn and Instagram and Twitter and all those things. And my website is drexelbert.com. And yeah, that's Perfect. Me.
Yeah, we will link up to all of that on the show notes page, the first book included, so everyone can get access to that. And this has been a super enjoyable conversation. Before we end, I'm going to take you back to something you said earlier by way of asking this final question and get you to leave our audience with some wisdom on this, which is kind of my thesis behind the podcast, which is the wellness paradox is this gap in trust, communication, and interactions between fitness professionals and the medical community. And to your point, it's just not the physical medical community, it's also the mental health community. So if you could take all the great things you said in this episode, particularly when you were talking about the need for fitness professionals and medical professionals to collaborate, and you can give one succinct thing for fitness professionals to focus on to bridge this gap with the healthcare community, what would that be?
The understanding that the mind and body are connected, and that we don't act alone when we're trying to get someone to be healthy through exercise, that we have to think about all the other domains, and that not only should we be reaching out to them, but we can stay in our lane and take little pieces, right? Take some meditation and take some nutrition and take some health practices and some mental health practices, as long as we stay in our lane and work towards, our clients' wellness.
Awesome. Renee Exelbert, thank you so much for joining us on the Wellness Paradox.
So nice to meet you. Thank you, Michael. Thank you so much.
Well, I hope you enjoyed that conversation with Renee as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a massive difference for us. Any additional information we'd like to share with you from today's episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 84. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again next week, please be well.